Let me take this opportunity to thank IT News Africa for the opportunity to speak at the Healthcare Innovation Summit Africa 2021. Ladies and gentlemen, before I start, let me introduce myself. I'm Dr. Rajeev Rao Eashwari. I'm the Director EHEALTH and Hospital Services at GAUTENG Department of Health. I've been in the e-health or digital health space for the last 15 years, and I'd like to share some of the ideas which I thought might be important going forward, especially if you have willing listeners at the other end. I'd like to share my thoughts. Uh, the question I'd like to ask is the network ready? And for this new phase of humanity, this has been a unique year. We have seen a turning of the table. The physical world saw social distancing as a norm. On the other hand, digital world went ballistic with nearly 1 million new internet users being added every day. Internet usage also grew at unprecedented rates, both in data volume and practical applications. Now we literally travel at the speed of light from one continent to the other, or even to a local grocery store. I've stopped visiting the store. We always order everything online. We learn on videos, we interact in e-conferences, we engage in news from other side of the globe. We as humanity, I believe, are ready for one network. Uh, there's a network readiness index that is a key indicator of how countries are doing in the digital world. The World Economic Forum's Network Readiness Index 2020 measures how well an economy is using information for communication technologies to boost competitiveness and well-being. Getting ready for the networked world creates new opportunities for firms and individuals in the developing world, eliminates barriers that have traditionally stifled flows of information and goods to and from developing nations, and promotes efficiency in a host of activities. Accelerating digital transformation in a post-COVID global economy, I'd like to quote two eminent people in the space. One is Vint Cerf, Google Chief Internet Evangelist. He says COVID-19 has highlighted a great disparity across our society. We are in the midst of a forced transformation, but I would argue that it has been underway for quite a while. Quote closed. There's another interesting one which I like. It's from Vera Singwe, Executive Secretary, United Nations Economic Commission for Africa. Even though there is a lot of celebration around how far Africa has come in terms of digitization, there is still a lot more that needs to be done if we really want to deliver an inclusive Africa. The benefits of participating in a network world, I believe, creates new opportunities, eliminates barriers, and promotes efficiencies. I can go through it, but I'm sure I'm talking to the converted. I'll move on. Like I said, I believe that we are ready and we have the world to prove. And then there is on an Africa level, we can talk a little bit more about that. And at a South Africa level, I'll talk a little bit more about that. I'm sure most of you would have been on this website. It's Worldometer statistics, and it has information, real-time information on world population, society and media, government and economics, environmental affairs, water, energy, and health. On health itself, there's a huge lot of information that's available. I don't want to go through the whole lot, but what is important at this stage is the coronavirus statistics. The information is updated worldwide. 224 countries are contributing to the information, and you have information in real time. And if you look at what is being provided at a world level, USA is number one, and if you look at South Africa, it's number 18. That is in terms of total cases that are being seen, COVID cases that are being seen on regularly. So this is up to the 15th. Those were the figures. Coming down to Africa, we are topping the list with 2.9 million positive cases, and we are in Africa. We are number one. So just to highlight that we are living in a networked world, and the information is being shared regularly. South Africa achievement so far: we have a South African national digital health strategy. We have a normative health standards framework for interoperability in e-health, which will form the basis of a system that allows IT systems of public and private sectors to talk to one another and exchange information. So COVID has brought, excuse me, COVID has got public and private sectors together. We are sharing information and we are sharing resources. Sorry about that. So the first time now we have been able to have electronic health records of some sorts across all nine provinces. And this process initiated thanks to the pandemic. We are able to share information across public and private sector at a national level. Other positive thing that has happened in the last 6 months to a year is that we have an health patient registration system which generates a number called health patient registration number, and it establishes a unique identifier. So more than 50 million South Africans are registered on the system and they have a unique identifier. So they walk into any of the facilities, they can register and get the number. South Africa coronavirus infections is being plotted using GIS to identify hotspots in South Africa on a daily basis. That is actually helping us manage the COVID pandemic. The electronic vaccine data systems, we are digitizing vaccination information across the country. And we have a portal that's available to the public as well. And we cover COVID-19 infections, vaccinations, vaccine management, hospitalizations, and COVID strategic information. So all this is available on the public domain as well. So this is the information what we get. If you look at on top, this vaccines has been administered across all the 9 provinces. It's 24 million plus, and we can break it down to Johnson and Johnson and Pfizer. So this information we are getting it on a daily basis because it's been updated from different facilities across the country. Coming to GAUTENG, we have 6.4 million, and we can break it down to Johnson and Johnson and Pfizer. The inclusive African initiatives, we have something called as digital health ecosystem for African countries, and I have provided the link there. There's a lot of information that you can actually see, and then we have another document that is being shared. It's on the public domain, tracking Africa progress in figures, and the African Digital Health Mission looks at the ecosystem, and we are looking at something that is efficient, affordable, inclusive, accessible, timely, and safe. I'm glad that we have Mr. Horn, JP Horn from Amazon is there. I'm sure is listening. This is where we need his help. But I think it's important that we look at how we can digitize activities around, not just in South Africa, but for the rest of Africa. The 4 stages of digitization. Are we ready to reimagine the work? There's a lot of work, but yes, it's possible. The 4 stages are digitizing the record. I'm referring to the clinical record of a patient. The patient folder at present it's in a physical form. It's a folder that chances of losing, misplacing, and all there. So we have to digitize this. That's one. Interoperability, connecting primary care providers to hospitals as well as hospitals to hospitals to improve efficiencies. The entire digital ecosystem, meaning the third-party applications, patient-facing systems, and enterprise systems have to talk to each other. We have so much of information that's available, so we actually can look at meaningful insights from the data. Converting insights into action that improve value. We're actually looking at value-based care, and whether measured by safety, cost, access, or equity. There's a very good article by Dr. Wachter, Professor and Chair of Department of Medicine at University of California. I've shared the link there. If you are interested, you can go to a little bit more in detail. This is a slide which I like, especially now with COVID and with the lockdowns. We have different types of networks. We have most of you are aware as the WAN, the WLAN, the campus area network, the personal area network, and what is important, I believe, is the body area network, which I think we should use it to manage our patients better. So we can use it, we can monitor the patients remotely. So that's a little bit more with by using sensors. We can actually look at blood pressure. We can look at we can look at pulse. We can monitor the pulse. We can look at ECG, EEG, etc. And then what is required is simple technology. It's not rocket science anymore. We can actually use it to connect the dots and share the information across the continuum of care. The social determinants of health, I put this just to highlight the fact that apart from the the social determinants of health, that these are conditions in place where people are born, live, learn, work, play, worship, and age that affect the wide range of health risk and outcomes. There are five key domains: education, access and quality, economic stability, social and community context, healthcare access and quality, neighborhood and built environment. What is important is that the latest addition to is broadband access. That has become a new social determinant of health, because that is actually impacting how we manage our lives. There's a reason definitely for hope, where it is easy to dwell on horrors of the pandemic. It has forced us to look forward and analyze how it has made us stronger and inspired us to adapt and innovate in ways we never thought possible. We should explore why healthcare professionals should be optimistic based on evidence of the past 18 months, and how, in the grip of an escalating pandemic, the industry responded and learned to adapt to a new reality. The pandemic has brought the public and private health sectors together. That's a very positive thing. We have been resisting that for quite some time, but that's one of the positives we have. What is required is a close collaboration between clinical work, information and communication technology, and organizations of medicine and healthcare. Those are the systems that we need to have close collaboration. There should be the three domains have to have an effective fit. Just to assist us, we have this Institute of Healthcare Improvement, where they were advocating triple aim, where we had patient experience, population health, in the process reducing costs. What has been added in the quadruple aim is to take care of the team that is providing the care. So that has actually brought to the fore, especially during the pandemic, we realized that the healthcare workers, all the healthcare workers, are very important in managing and improving the quality of service that is provided to the community. I'd like to talk a little bit on the collaboration. I strongly believe that if, as government, we don't collaborate with the industry, academia, and the prospective funders, will not be able to achieve it. I mean, that is happening, but not at the pace I would like it. But that is what I would like to see happening going forward. The Stanford Medicine Health Trends. This slide I just put in to highlight the fact that there's a rise of data-driven physician. And the ones which I've highlighted, which says that an industry under transformation, healthcare providers make new developments, transformation gap in healthcare, that's huge. And the physicians, especially the end users, are under pressure. And the future of success depends on data-driven physicians. We have information, but we have to use it to manage the patients better. Just a little bit more on the data-driven physician. It's an unprecedented opportunity to transform medicine and improve patient outcomes. And we are encouraged to see current and future physicians taking steps to actively prepare for this new era of data and digital health. Moreover, issues such as poor work-life balance. This has come to the fore because now people are working from home, and there seems to be issues around managing the work-life balance. And that is ending up having physician burnout. I think that is something which the smart technologies such as artificial intelligence, predictive analytics, and conversational artificial intelligence are going to be part of the digital disruption in the healthcare industry. The goal is to free up tedious tasks by clinicians and hospital administrators to process and make decisions based on insights gained. This is the tsunami that we have been for the last 18 months. And the latest tsunami, I believe, is the Data Tsunami. It sounds like a title of a bad disaster film, but the Data Tsunami is actually one of the biggest issues impacting healthcare today, positively and negatively. The colloquial term refers to the huge amounts of data being generated now that healthcare and IT have become so closely linked. The other thing is the talent tsunami. This is an article that was published recently, just about 2 or 3 days back. South Africa is facing a talent tsunami. People are moving in droves, and people are resigning, and then they're looking at work-life balance. So that's a very good article. There's a link there, but if you Google this, I'm sure you'll get it. So I'd like to end with this slide. This is one of the realest things I've read. Just because you're right doesn't mean that I'm wrong. So you just haven't seen life from my side. I'm a very optimistic person, so I'm still continuing trying. So hopefully we'll achieve it one day, very soon, with the help of colleagues and with the help of like-minded people. Thank you very much for your time. If there's any questions, please feel free.
Thank you, Doctor. That was very, very insightful. I would like to maybe at this time ask our audience to pose any questions that they have in the Q&A section on the portal, and we'll address or we'll direct those accordingly. But maybe just reflecting on what you were talking about in terms of the rollout of the vaccine. So if we take, for example, the rollout of the vaccine across South Africa and across many of the other African countries, but maybe focus on South Africa itself. There's a lot of criticism around the speed at which the vaccines were being rolled out and also the adoption of that. But, there was, and I can't remember who did this very quick analysis, but when they looked at it, removing the time bias and looking at it at a week-by-week basis and a project-week basis, it found that South Africa was, very much on par and maybe ahead of certain countries in terms of the actual rollout. But the delay obviously comes in, South Africa and rest of African countries receiving the vaccines, quite a few months later, opposed to the rest of the world. So that, it demonstrates that South Africa has the capability to rapidly execute on certain initiatives. But there's still that delay when it comes to the first world or the third world component. Now, specifically from a healthcare perspective, how do you see that changing in the years to come by leveraging technology and leveraging innovation and collaboration to bring South Africa and the rest of Africa, in the sort of mainstream components when it comes to delivering affordable and quality healthcare?
That's a very big. The thing is that South Africa, I think we are able to keep up with the pace because thanks to the technology and thanks to the information that is being shared from every facility that is vaccinating, and that gives us an edge over others who don't have the capability of monitoring on a daily basis. In fact, that is what is happening at this stage, and we are ready. There was a time where we didn't have enough stock, but that is history. We have enough stock. There's a slight hesitancy on behalf of the citizens who are not coming forward in numbers at the pace we wanted. But we are getting there slowly but surely. We have different campaigns at different levels, and we are using it to convince people to. We are using churches, schools, etc. To convince the citizens to come forward and take the vaccination. And the numbers, like I said, it's not at the pace we wanted, but we're getting there. I'm sure very soon we'll get there.
All right. Thanks. And maybe another question. When the pandemic first hit us last year and we went into lockdown, there was an overwhelming sense of urgency that came both from the public and the private sector around collaboration. And there was that, common objectives around supporting government and supporting the country around dealing with the pandemic. And now that, and during that time, we saw a lot of organizations come to the forefront in terms of providing aid, in terms of providing support, resources, so on and so forth. And now that we've gone through 3 waves and we're potentially going to go through another wave come this December, how do we leverage those particular experiences and ensure that there's longevity in that partnership and collaboration models that exist between public and private sector? What are your thoughts around how we can achieve that long-term sustainable collaboration?
Like I said, one of the positive things that have happened is the close collaboration between public and private sectors. And we have specialists, public health specialists, who are actually assisting us in analyzing the data that is available, and we are able to work around it and make things work in our favor.
Okay, no, perfect. And I think maybe just one additional question. In your presentation, you spoke about the care teams and focusing on ensuring that the healthcare workers and the individuals that are effectively interacting on the front lines with the patients are taken care of. And to kind of paraphrase what Steve Jobs once said in terms of take care of your employees, and your employees will then take care of your customers. How do you see us better supporting these frontline workers and healthcare workers in the years to come? How do we ensure that they have the right levels of training, job satisfaction, and being able to actually, take away the burden of the administrative tasks that are currently in their role, so that they can then focus on their specific profession, which is ultimately taking care of the patient. How do you see that evolving over time?
There are various initiatives. I think one of the most important thing I believe is that there's an opportunity now to use technology to empower the health workers, especially in the rural areas where they get advice in real time, and that is possible if you have connectivity at the facility level, and that is what will actually help them or give them more confidence that they are not all alone in the rural areas, and they have somebody at the press of a button or a click. They can connect to a medical officer at a district hospital level or a specialist at a regional or academic hospital level. I think that is where the opportunity I believe we have, and then by digitizing the various activities, we can actually save time by sharing information across the continuum of care. If you have information at a clinic level, if it can be shared when the patient lands up at a district or a regional hospital level, then you save time, because then you have the information there right in front of you, and you'll be able to manage better. So, like I said, there are a lot of initiatives that are happening, but again, I must admit that it's not at the pace I wanted, but we are getting there.
Yeah, I think it's always the question of the pace at which the individuals would like to see that change occur. You almost have to kind of build that plane as you're flying it, and put things in a very sort of agile and minimal viable product development or evolution going forward. So thank you very much for that piece. If there's any other questions, please do put it into the chat window, and we will address it. And we look forward, Doctor, to the panel discussion later on this afternoon as well. So thank you very much for your time, and thank you for your presentation.
Thanks, Mr. Naidu. Thanks.